workplace safety hearing the Health Committee's held since 2010, when we spent a great deal of time discussing mine safety because of the most tragic accident in the 40 years that had just occurred at the Upper Big Branch mine in West Virginia. 29 men lost their lives in that single accident, yet they represent just a fraction of the workplace deaths that occur all over the world. Here in the U.S., statistics confirm that we are making significant progress. Workplace fatalities, injuries, and illnesses continue their historic decline. Since 2003, injuries and illnesses have decreased by nearly 30%, and fatal injuries have decreased 19%. Despite this decline, I agree with the chairman that we can and must do better. I remember when my daughter was going to have a tonsillectomy, and the doctor explained to us that it's 99 and 9/10% safe. But it occurred to me that if that 1/10 was my daughter, it was 100% to me, and I recognize that to all of you in the audience too. So we do have to do better. Workplace safety is surely one of the most important missions Congress has authorized for the Department of Labor. There are literally lives and livelihoods on the line. This hearing focuses on one tool: issuing new safety and health standards by regulation. This is a necessary tool, and I'm interested in the findings of the Government Accountability Office, GAO, on this subject, but I would also encourage OSHA to better pursue multiple methods to improve safety, rather than focusing all its resources into new regulations and stronger enforcement. Voluntary programs involving employees and management, such as the voluntary protection programs, have been shown to make workplaces considerably safer and save money. Yet under the current administration, VPP has been threatened and undermined. Instead, we should be talking about expanding VPP to smaller employers and making it even more effective. I'm pleased that several senators sitting on this committee have co-sponsored legislation introduced by Senator Landrieu and I to preserve VPP. I thank Senators Hagan, Isaacson, Murkowski, and Burr for their support and look forward to opportunities to bring this bill up for a markup. I've been to some of the ceremonies where companies are being awarded for their safety at these VPP sites, and I know that one of the reasons they're successful is the pride that all of the employees are taking in making sure that all of them are safe. Workplace drug testing is another important way to reduce risk of injury and death in the workplace. All of the regulations and required compliance in the world are not going to work if an employer or manager disregards them because his or her judgment's impaired. The field of workers' compensation insurance has developed a long record of experimentation with strategies to make workplaces safer and has measurable results. Every state creates its own workers' comp regime. OSHA should look at the best practices out there and determine if there are any new ideas that can be translated to the federal level. As someone who has run a workplace safety program personally, I'm very supportive of giving employers quality information and flexibility to see what works best to keep their worksite safe. Today, even the smallest employers must grapple with thousands of pages of regulation and burdensome record-keeping requirements. But what should matter the most is the result, and that's keeping workplaces safe. Since it was created in 1970, OSHA has been empowered to establish standards for workplace safety and health. Congress has entrusted OSHA to identify common workplace hazards which cause injuries and illness, to conduct and survey research on the cause of hazards, to discover what preventative steps can be taken to mitigate hazards, and to issue and enforce regulations. Given this broad delegation of authority, Congress also required that OSHA use it appropriately. A new standard must address an actual hazard. The preventative steps OSHA may mandate must actually work to reduce the risk. They must be feasible to institute and cost-effective. If the costs will weigh heavily on small businesses, OSHA must engage in panel discussions with actual small business stakeholders. All of these considerations are appropriate for OSHA to undertake before finalizing a new standard, and this committee should closely scrutinize any proposals to shortcut them. As the GAO report released today makes clear, the interval of time between when a standard is proposed and finalized can range from 15 months to 19 years, which is comparable to other agencies GAO has reviewed, such as the Food and Drug Administration. The finalization interval has varied throughout OSHA's existence. In fact, it was much longer in the 1990s than in either the 80s or the 2000s. GAO reports on the many factors that affect the finalization interval. Some of them are the same issues facing regulations from any agency, such as shifting priorities. Change in administration is a clear example of when priorities shift, but they also shift under the same leadership when different hazards capture attention. For example, today's report notes that ergonomic standard issued at the end of the Clinton administration was proposed and finalized in just 1 year. In order to accomplish that, the vast majority of OSHA standard-setting resources were focused on the ergonomics rule and taken off of other standards. While most standards use about 5 staff members, OSHA deployed 50 standards office staffers, 7 attorneys, and half of the agency's economists for the development of the ergonomics rule. You don't have to be a management guru to see how disruptive that would be to the development of other agency priorities. In the administration's response to this GAO report, OSHA endorses the notion of statutory deadlines imposed by Congress to speed standard setting. Deadlines imposed by Congress or the courts do indeed seem to speed up the regulatory process by about half, but OSHA should be cautious about wishing for such dictates. The entire point of creating OSHA was to allow experts to determine the most dangerous and addressable hazards, the best ways to mitigate them, and when it was most appropriate to do so. If Congress is setting the agenda instead of safety experts, American employees will not benefit. Let me cite a recent example. In 2007, legislation was passed by the House of Representatives to require an interim standard within 90 days and a final standard within 2 years to restrict the use of flavoring additive. The bill was not taken up in the Senate. In the Bush administration, OSHA did not initiate rulemaking. One of the co-sponsors of the bill, Congresswoman Hilda Solis, became the Secretary of the Department of Labor just a year later. Yet, under 3 years of her leadership, OSHA has not finalized a standard for the flavoring additive. In fact, they found that a new regulation was not needed because manufacturers acted quickly to mitigate the risk. Therefore, if the legislation to dictate new standards had been enacted, OSHA would have spent valuable resources on regulatory effort that was no longer necessary. I also hope this GAO report will not be misconstrued to justify limiting stakeholder involvement in the OSHA's regulatory process. Stakeholder review and discussion is one of the most beneficial parts of the rulemaking process. That's where you work out the kinks of the new regulation and ensure both that it will work in the real world and that it accomplishes the goal in the most efficient manner. Many of the best examples of regulatory efforts that have failed because of insufficient stakeholder outreach come from OSHA itself. One of today's witnesses, Mr. David Sarvadi, will testify about those missteps and suggest ways OSHA can be more effective in setting new standards. One of his suggestions is to involve stakeholders earlier in the process, not just after the risk has been assessed and the remedy formed. There's one recent example of OSHA standard setting which I do want to comment on because I've had a long involvement with the issue, and that's the new hazard communication standard finalized last month. OSHA spent more than 6 years working to harmonize the current hazard communication standard with the global standard, recognizing that chemicals and goods routinely cross country lines today. It's beneficial to all involved if the hazard labels in the material safety data sheets, MSDS, are uniform and easily understood. This rulemaking has had a great deal of support from all stakeholders. Several years ago, Senator Murray and I introduced legislation intended to aid this rulemaking process by involving stakeholders through a commission. Last year, President Obama listed this regulation as one of his accomplishments to reduce costs imposed by regulations. With all of this support, this should have been an easy win. Instead, the rule that was finalized last month included new provisions not covered in earlier stakeholder outreach and is already being questioned on several fronts. Safety data sheets will have to include additional information not required by other countries, erasing some of the cost savings. The final rule also inserted 2 provisions that are sure to cause confusion by having it cover combustible dust, which is an undefined hazard, and unclassified hazards. In this case, shortcutting stakeholder involvement and other regulatory steps required by law have only led to more questionable standard that may now be prolonged even further. Considering that this regulation was advertised as reducing regulatory burden and saving money, it's even more disappointing. And I used to do some work in safety in the oil well servicing business, and found that what works for the oil well drilling is not the same safety procedures as for the oil well servicing, and that's why stakeholders need to be involved in the process so that it will actually work with the kind of equipment they're using, which can often be different. I look forward to hearing the testimony and suggestions for improvement from today's witnesses, and I thank you, Mr. Chairman.